Balloon sinuplasty is a tool to help open or widen the natural drainage pathways of the sinus. So traditionally when we would do sinus surgery, we would remove tissue. So if we want to open this sinus, we would remove these little partitions here so that this sinus would be more open, because the goal of any sinus procedure for treating these types of problems is to improve the access or ventilation of this to the sinus, and in some patients remove sinus disease. In your case, we really just want to improve the ability of the sinus to ventilate. Okay. So this is actually the balloon sinuplasty device, and there's other versions. So this is the one I like to use, and it is just what it sounds like. It's a tool that allows us to find the natural pathway of one of your sinuses, and then once we confirm we're in the right location, because there's this nice bright light on there, we advance the balloon across that natural pathway, and then we literally inflate the balloon, which is going to spread all the tissue around that pathway outward. This is a 6 millimeter balloon, so you're going to get a 6 millimeter dilation, and then we deflate the balloon, okay? And then we just take everything out, right? So a dilation procedure, as opposed to removing tissue, expands tissue, or the pathway to a sinus, and then because that pathway is surrounded with thin bone, like eggshell thick bone, it's going to heal in that new open position. So I have an animation I can show you to treat this sinus with this particular device. So in this case, it's showing an infection in that frontal sinus, okay? And you see the swelling along the pathway. So we advance the tool along the natural pathway, we advance the balloon, we inflate the balloon, we push the bones out away from the pathway, and then we remove the device, okay? And we can also irrigate a sinus if we needed to at that time. And then it's going to heal in this open position because they're bone. So we're not dilating fat or soft tissue, we're dilating bone. Just like if I were to, if you get popped in the nose and your nose is all crooked, and if you don't get it straightened out, it's going to heal crooked, right? Because it's bone. So it's going to heal, just going to heal in the outward position. So dilation would involve dilating that sinus, whereas more traditionally we would actually take all of these little partitions down to open that sinus, which is more involved, Yeah, so a balloon can be done in the office or in the operating room. I usually do them in the office. Usually takes about 30 to 40 minutes. That night you'll feel congested because it's still a procedure. It's still there's some trauma, so there's some inflammation from the procedure, so that's why you feel congested that night. A little achy, but there's no moving parts. So I don't know if you've ever been accidentally bopped in the face playing a basketball or something, but when it happens, it hurts, but as long as you don't touch it, a little achy, doesn't hurt too much. Next day, you're pretty much back to doing your normal activities. It doesn't require packing or splints or anything that you may have heard of for traditional sinus procedures. So all in all, it's a pretty quick recovery. We don't remove sinuses with balloon dilation. We just improve Mother Nature. We're just helping Mother Nature be more efficient. You still have sinuses, right? So even if you have a balloon procedure, you could still get sick. You could still develop a sinus infection, just like if you had a more traditional sinus procedure. It's just, it's less painful, you heal faster, it's less risky, it's quicker to do. And for you, a great option because you don't have a lot of sinus disease and your main complaint is some pressure and recurring infection.